I ended up with adult chickenpox at one stage there and ended up in the isolation wards. And this is where things changed for me. I'd gone through all my stem cell and they had done the transplant back into me. I was quite sick and I ended up with adult chickenpox and ended up on the isolation ward. With no end in sight. I'd gotten to a point where I just couldn't see an end to it. You know, there was one thing after another, 17 blood transfusions in 2 weeks or two, you know, and it just kept on going on and on and on. And while I was up in the isolation ward, I had one of them, some people would say, a miracle, a light bulb moment, something happened, I wake up cold, I'm not quite sure, lying there. They'd come in, they'd done all their stats on me in the morning, done my blood pressures, taken my bloods, and said, look, you know, you're in a pretty bad way, things are going wrong here, you know, we've found adult chickenpox, rah, rah, rah. I was sitting there looking out the window, and I had a very calming moment, and then the doctors came back in about 3 hours later. There was a little bit more to it than that, but yeah. And they come back in about 3 or so hours later and did my stats again and went, your temperatures have dropped, everything seems to be fine. We don't understand it. You can come back down onto the wards. 2 days later, I was out the hospital. It happened that quick, from being that sick to being at the Leukaemia Society, you know, out of the hospital. It was there and then it wasn't there. It was just that fast, you know what I mean? So there is a light at the end of the tunnel. No matter how bad it gets and how sick you feel on that day, that afternoon, you could feel like a whole different person. And it happened that fast for me. And it happened on quite a few occasions where I thought, you know, I'm not going to get through this day. You know, they've hooked me up. I've got bags of blood here, and they've injected me with this, and they're taking that, and they're taking me down for scans and stuff like that. And that you just feel like I'm not going to make it, you know. And I've signed everything over to my wife, and I've done my will, and I've done my power of attorney, and I've made my, you know, my statement on how if I'm to be revived or not. And by the afternoon, it's changed again, you know, so it's a strange process. You know, you can feel very sick one minute and feel fine the next. It's very tricky, you know, it's hard. It's nothing easy about what you're going to go through or your carer's going to go through as well. You know, your carer has to deal with all this. You know, in the meantime, you're throwing up in the bucket. You've, you know, for several weeks there I wore the adult nappies because I did get the diarrhea and I got stomach cramps and I lost a lot of weight. I went down to about 56 kilos at one stage. So I'm up to 75 kilos now. So I lost a lot of body mass and a lot of weight. Very embarrassing to sort of, the first time around was I was running to the toilets and, you know, having accidents, and I wasn't very keen on wearing, you know, being the sort of person I am, adult nappies, you know, come on, this is not going to be me. But I chose to put them on in the end, and, you know, it was perfectly fine. Once I got past that barrier, what I'm trying to get at is you've got to get past that barrier. You know, I had to get past that barrier. And once I got past the barrier of that and the embarrassment of some of the other things I had to do, because the main topic of conversation with stem cell patients and kidney patients is your toiletry habits, how much do you wee, you know, and they're always measuring, they're always discussing, they always want samples, you know, it never ends, you know, your toiletry movements seem to be a fascination for some people, you know, and so that, you know, there's lots of little hurdles you have to pass over because this doesn't happen to you in normal life, you know. People don't ask you these questions, you know, and all of a sudden every day somebody's walking in and going, oh, Mr. Aitken, have you been to the toilet today and how much did you produce and rah, 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 and did you do this and did you do that, you know. And you have to you have to explain this with other people around, other doctors, other nurses, other people in the room, you know, and I found it very difficult myself, never being in that kind of situation and not being a sort of a person that discusses my sicknesses or anything with other people, really. You know, I don't have a GP. Yeah, so it was very difficult and very embarrassing in some stages, but you get over it very quickly because it becomes so routine. You know, you get yourself into a routine, they get you into a routine. The doctors and nurses have had hundreds of patients, thousands of patients go through that they've asked exactly the same questions to. So when you're answering them, it's not just the first time they're asking it, and it's, you know, you learn that, hey, they ask everybody these questions, so therefore it's not so embarrassing just to come out with it, you know, just to sort of say, oh yeah, this happened to me and this is what, and always tell them, you know, the little things have made the difference for me, you know, the little, just the, you know, even to this day I go in, and if I've had a headache twice a week, you know, I tell my doctor I've had that headache. You know, if I've got a pain in my side or a cramp, I tell them that. Sometimes they look at you and you get the feeling that it's going in one ear and out the other, because that's not quite what they're interested in at that point in time. But they are actually listening, you know, but they are thinking of other things as well. And then if you, because I suffer from cramps still to this day, and they've told me there hasn't been anything they could do. All the specialists I've seen, all the doctors I've seen have been telling me that, oh, there's not much we can do for the cramps, Mark, you know, sorry, there's not much we can do for the cramps. Now, the other day I went in and I had a young nurse, a young doctor treat me, and we were talking about the cramps, and she looked at me and she went, so we haven't got you in on anything for the cramps? And I said, no, but every time I've come in here, from the very first day I arrived at this hospital, I have spoken about these cramps. And she said, yeah, I can see this. Why hasn't somebody got you on magnesium? I said, oh, I don't know. So 3 weeks ago, I started magnesium tablets. My cramps are virtually gone. You know, so I did nearly 8 months of having cramps and being told by every doctor I seen that there was nothing they could do for my cramps. And then just one doctor out of the blue went, hey, why are you on magnesium tablets? And now I'm on the magnesium tablets. I can actually cut a steak. Before, I got to a point where I had to get people to cut my meals for me because my hands would cramp up around the knife, and I couldn't hold things. I was getting severe cramps. Now I can cook, eat, cut things, and it was as simple as just constantly repeating every time I went in to every doctor I seen that I was having these cramps. And then one of them clicked and went, this is what we have to do to help you, Mark. Take these magnesium tablets. So simple, so easy, but if I hadn't have spoken every time, I would have missed that one doctor. You know, if I hadn't have said that this is an ongoing thing with every doctor, I might have missed her if I'd given up. You know, so what I'm saying is, don't give up. If you feel as though you have a problem, you have something, it might be so minor, and the doctor seems to be putting it to one side each time because they're dealing with more higher issues at that point. But as they knock out them higher issues, these little things will come to their attention, and they'll realise, hang on, you've been saying that to me each time you've come in. Now's the time that we can think about trying to fix that up, the headaches or the cramps or stomach aches or bowel problems, or, you know. So never give up on yourself when you're talking to your doctor. You know, it's so easy to go, oh, look, he's not interested, so I'm not going to mention it this time, you know. But don't do that. Mention it every time, you know, until somebody goes, oh, yes, we can do something about that, or, oh, right, it's a simple thing like, we just need to do that. Here you go, you just need to take these. And it has changed my life. It really has changed my life, just taking magnesium tablets. So simple, so easy. You know, cold water, as I say, is a must when you're going through the stem cell transplant. The other thing I found was when they asked me to do my stem cell and everything, you get given injections that you take each day into either side of your stomach. They give them to you in a needle form. Now, giving yourself a needle, I'm not sure about everybody else here, is not an easy act. And getting somebody else to do it for you is not easy for them. So, I mean, I shake considerably. So what we discovered was that you can get like little pads that will stick in, and then you can put the needle into them. So it actually doesn't go into your skin. You have to ask for them. They don't offer them for some reason. But you get 2 of them, and they've got like a little rubber grommet on it, and the needle goes into the rubber grommet, and you can do that way. And I had to do 6 days, so it's two a day, you know, so it's quite a lot of needles, you know, if you have to sort of inject yourself. So these little things, wonderful invention, you know, absolutely wonderful thing. My wife did my injections for me. You know, I'd just lie back, she'd just get the needle out, put it inside the little grommet, both sides, done. You know, no needle going in my skin, which, ooh, you know, I'm not a very tough man where it comes to needles, you know. So they were a wonderful thing to have put in when I was doing my stem cell, when they were doing my harvest. So they're a good little tip. Ask them for the, I can't remember what the name of them are, no?
If you just said butterflies, they know what you mean.
Yeah, butterflies, I think they are, something along them lines. They are a wonderful thing to have. The actual process of retrieving and collecting your stem cells is quite easy. You know, you go in, they plug you into a machine, you lie on the bed, machine takes your blood out, goes through the machine, just keeps going around and around and around. The girl sits there, you chat. There's no pain involved. There's no, you know, it's quite a lazy process, you know, and putting it back in. I was lying in bed. A nurse came and said, "We're going to put your stem cells back in." And some guy came in who actually looked like a scientist. Like you would imagine a scientist to look. This guy was out of a cartoon character, you know. He was the scientist. And he walked in, and that's how he introduced himself. He walked into the room and went, "Mr. Aitken, I'm the scientist who did your stem cells, and I'm going to put them back in." And I sort of looked at him and went, "Fine." And they hooked it up to a bag. It lasted about 15 minutes. It was like a transfusion or any other thing. And it was over. And I sort of looked and went, "Is that my stem cell back in?" And they went, "Yes." I was expecting to be hooked up to another machine and go through the whole process and, you know. But no, it was just a bag on a hook in the arm, and it was over within minutes. And there you go, my stem cells were back in again. Then you go down for your marrow transplant biopsy, which is not painful at all. I actually thought it would be. I mean, they're putting a hole in the side of you, taking out a chunk of bone, and they do it in exactly the same place every time. So I've had 2 now, or 3, and it's in exactly the same place. I went in there and actually said to them on the second time around, "Can we actually change positions and do it somewhere else, because I'm getting bruised here?" I mean, they were a month or 2 apart. And they said, "No, we actually have to take it from exactly the same site, so we get exactly the same readings every time." You know, so it all comes from exactly the same place. So I had it in my hip here. Very simple. You go in, they give you something to send you off to Noddy's. They actually wheel you in the chair that you're sitting in. The chair lays out into a bed. They roll you on the side. I was actually awake for one of them. They didn't give me enough sedative to knock me out. Me and the doctor were chatting, and the nurse, and as we were chatting, he just went ahead and did the procedure. I did feel it. It was painful, and the next time around, I did mention to him that it was painful and that I would like to be knocked out the next time and make sure I am asleep when you do it. But even being awake while he did it, it wasn't that painful. I mean, it was painful. It was as painful as having a tooth pulled, or, you know, and knocking off your toenail, or, you know, it hurt at the time, but you get over it very fast. Within an hour of having the biopsy, you're up, you're moving, you wouldn't even know you had it really. You've got a bandage on there, it just stays on there until it falls off basically, and that was it, you know. So that wasn't too bad at all. It sounds very scary because you're lying in these chairs, and you know they're going to go in there and they're going to take a bit of bone and on the end of a. It's not like that. It's not like that. I lied there and I was terrified, but when they actually took me in and we did it, and I came back out and I was awake within minutes after doing it, I sort of lied there and went, oh, yeah, that's a bit tender, you know, but that was basically it. It was a tender, and there was no more else to it. As I say, I've been through a kidney failure, stem cell transplant, and come out the other end. I'm eight months past my stem cell transplant, 7 to 8 months, I think, somewhere around that, since I've had my stem cells put inside me. I got partial remission, which they're looking at maybe giving me a year. So I've already done 8 months of that. We're not sure where they're going to go with me after that, if I'm going to have another stem cell transplant, which I do have frozen and ready to go in, or I'll go for a bone marrow. They're not quite sure. Basically, my story in a condensed form, you know. What I really want to say is never give up. Get up every day, even if it's just getting off that bed and walking around the kitchen, or doing something. Lying on that bed will make you worse. It really will make you worse. I have been there, I have done it, and I can tell you gospelly that it will make you worse. I have done the lying around thing, and I've done the get up and moving around thing, and the getting up and moving around thing certainly works better than lying around in bed.